Hello, I am Dr. Inda Mohan Chug, Senior Director and Head Department of Neurology and Sleep Medicine, Max Hospital, Shalimar Bagh, New Delhi. Today I am going to talk about COPD. COPD means chronic obstructive pulmonary disease. It is a chronic disease of lungs. In this, two diseases are combined: chronic bronchitis and emphysema. This disease mostly affects smokers, the people who consume hookah, bidi, cigarette, tobacco in smoking form. In 10% non smokers, we have seen the cases of COPD. Who are these people, or in which conditions they live in, where the air pollution is more, or a factory, or a place of work which contains dust? Women who do not smoke or are non smokers can also develop this COPD due to the smoke of the stove in old days or in the place where there is a stove in the village. Secondhand smoke means sitting with someone who smokes can also cause this. A symptom of this is a cough with mucus that lasts for a longer time, shortness of breath, and chest noises. Due to this, systematic symptoms such as shortness of breath, weight loss, loss of body strength, leg swelling, body muscle wasting are seen in COPD patients. We mainly divide COPD into four stages. In stage 1, the patient has a mild cough and mucus. Stage 2 and 3 have moderate and severe COPD, in which the patient suffers from cough and mucus for most of the year and is short of breath. Moderate to severe COPD is shortness of breath after doing any light activity, such as climbing stairs or doing regular activities. Severe COPD is stage 4, which is very severe, in which the patient has to sit at home and cannot do normal activities such as bathing, going to the bathroom, using the toilet, or changing his own clothes. These patients mostly use oxygen therapy. How to diagnose COPD? If any patient has cough, mucus, or shortness of breath, which is long standing and increasing and chronic, then a simple test for this is pulmonary function test or spirometry. COPD patients have a lack of oxygen, so for that, there is a pulse oximetry test by which we can see the oxygen saturation. After that, we do ECG and echo test of the patient so that the patient knows if they have any kind of heart disease or not. After that, the patient is advised to undergo X-ray and CT scan so that the patient knows whether there is any tumor or any other disease in the lungs. Along with this, ABG test of COPD patients is called arterial blood gas analysis, which tells us PaO2, that is oxygen content, and PCO2, that is carbon dioxide content. COPD patients often have type 2 respiratory failure, which increases the amount of carbon dioxide. Most important in the treatment of COPD is inhalational therapy, in which medicine is delivered by mouth into the lungs. It includes different types of inhalers, rotacaps, nebulizer therapy. This is called bronchodilator therapy, the most important of which are anticholinergic drugs, beta agonists, inhaled corticosteroids to be taken by inhalers, rotacaps, or nebulizers as prescribed by the doctor. Then some tablets are given in COPD, which along with methylxanthines. If the patient is very sick, then he is given oral steroids for short term. Antibiotics are given if the patient has an infection. Along with that, if there is any comorbidity for treatment in COPD patient, such as sugar, heart failure, or kidney disease, then those medicines are given along with it. COPD has complications such as heart disease, heart attack, heart failure, arrhythmia, in which the heart beats irregularly, and stroke, followed by increased pressure on nerves called pulmonary artery hypertension, blood clots called pulmonary embolism. 80 to 85% of patients with COPD are smokers. Therefore, they have a high rate of cancer and their lungs are damaged due to emphysema and chronic bronchitis, due to which they have a high rate of chest infection, pneumonia, and often fill the lungs with air, which is called pneumothorax. These types of complications are more common in COPD patients, so you should immediately consult a doctor or go to the nearest hospital. Now, let us see how to live with COPD, how people who suffer from COPD can live their normal lives. The first and the most important solution is to stop smoking. People who smoke hookah, BD, cigarette, or smoke tobacco should stop smoking with the help of a doctor or a friend. Cigarette, hookah, and any type of tobacco that is inhaled should not be used. After that, if any kind of infection occurs, immediate treatment should be given. Avoid going to places where there is a lot of dust and pollution, which can increase the risk of illness. Keep your home and surrounding environment clean. Do not use items that cause the dust in your home to fly around. Along with that, pay attention to your diet and eat a balanced diet. Even after this, if your COPD disease does not stop and the symptoms are increasing, then you should show the doctor and get the treatment if you have problems with heart, kidney, liver, BP. You should check if you have any complications of COPD or not, and you can live a good life with COPD with regular doctor's advice. I wish you all a happy and a very healthy life. Thank you.